mid-1980s, after decades of conflict left Vietnam in ruins, a massive political, economic, and social overhaul known as Đổi mới ushered in greater opportunities for private investment and a loosening of the previously centrally controlled economy. This began an explosion of commerce, a rapid increase in gross domestic product, and a greater reliance on the private sector as an engine of growth. These changes had unintended side effects, among them a decline in an already basic low quality of healthcare for poor and rural Vietnamese. In the healthcare sector, the need for structural assistance made an immediate impression on Chuck Feeney as he was taken on a tour of hospitals in his first visit to the country.
Chucks want to really look at improving healthcare services in hospitals because that's what he saw was needing at the time, especially these tertiary care hospitals where you see overcrowding, you see crumbling buildings, you see lack of equipment, you see people sleeping on the ground, and then just the whole mess.
As Atlantic learned more about the fundamentals of public health in Vietnam, it became clear that along with upgrading and building healthcare facilities, instilling a culture of public health was critical as well.
The public health deans were telling us if you're interested in improving health and having an effective impact in a modest period of time, address injury prevention. A bit of a surprise, especially if you're used to building hospitals to deliver hospital-type care. You're probably seeing a lot of injuries coming into the emergency room, but the root cause of that is traffic patterns, traffic safety, and prevention helmets would be a very important part of that.
Atlantic grantees worked for many years to get a national helmet law passed. It has saved thousands of lives per year and reduced debilitating brain injuries significantly since 2007. Atlantic also recognized that tobacco is one of the main causes of disability and deaths in Vietnam. Working with government and non-governmental institutions, Atlantic has successfully funded a comprehensive strategy to improve tobacco control through legislation and communication campaigns. Major grants also were approved to build capacities for important national institutions such as the National Hospital of Pediatrics and the Hanoi School of Public Health. The plan for the National Hospital of Pediatrics was to build an internationally recognized center of excellence and a standard setter for pediatric care throughout the country. At Hue Central Hospital, Atlantic funded the creation of a new cardiology center that quickly moved to the forefront of heart surgery in Vietnam.
Đây là một cái công trình hoàn chỉnh đầu tiên về mô hình về trung tâm tim mạch tại Việt Nam. The first model cardiac center in Vietnam và dấu ấn tốt những quan trọng hàng đầu đối với trung tâm tim mạch. Thì chúng tôi thực hiện một cái ca ghép tim đầu tiên ở Việt Nam.
In the provinces, the emphasis on primary care took Atlantic into the commune health centers, which was an important place of entry for healthcare. There was a significant amount of work to be done because the structures were dilapidated.
It became clear to us, though, that to be effective in delivering health services, we were going to have to address the health system and emphasize opportunities to get those health services out into the community and focus on primary care. And so the development of community-based health centers in Vietnam was kind of a marriage of the two, creating some facilities that would house the delivery of community-based primary care services, a marriage of our predilection for bricks and mortar with our focus on human resources and community-based primary care.
Together with the provincial government, Atlantic helped to fund the construction of more than 800 commune health centers in 8 provinces with a population of 8 million people with a total investment of more than $80 million. The goal was to create an integrated model from rural commune health centers to urban hospitals, with the hope that the government would implement this model in other provinces.
Nói đơn giản như vậy, trong lĩnh vực chăm sóc sức khỏe ban đầu, chúng tôi có những dự án nâng cấp cơ sở, trạm y tế, trang thiết bị cho cơ sở đó. Ngoài ra chúng tôi có những cái hỗ trợ để nâng cao năng lực của cán bộ y tế công tác tại tuyến cơ sở. Tại vì người ta phải có nâng cao năng lực như vậy, người ta mới có thể sử dụng những cái phương tiện vật chất và trình độ của họ có cao như vậy thì họ mới có thể nâng cao cái chất lượng chăm sóc sức khỏe cho người dân địa phương. Đó là một việc.
Since 1997, Atlantic Philanthropies has invested $381.8 million in improving higher education, public health, and primary health care in Vietnam. Since 2003, the focus of the grants has been on improving the primary healthcare system while instilling a culture of public health nationwide. And what are some of the outcomes? Fewer deaths due to motorbike accidents, better functioning hospitals with improved patient care, 6 modern collegiate libraries, and, at a particular point in time, 800 community-based primary care centers, 10,000 open-heart surgeries, and 15,000 cardiovascular interventions.